Hi, my name is Tim Lorenz. I'm with PMD Healthcare. You are receiving the link to this video as a result of your interest in telemedicine. It should have been sent to you by your distributor rep. I wanted to share with you some insights since we've been getting a lot of requests for further information, understanding of telemedicine and how it works, and specifically again about how our program works and can benefit you. Things are in disarray. Patients typically either don't want to or hesitant to come into a physician's office, and so the question is going forward, how are you going to care for patients? Medicare really has been strongly in the last few years trying to incentivize physicians and patients to do more care remotely, and of course now that's almost a necessity. Part of Medicare's desire is that by staying in greater contact with your patients, there's going to be more preventative care, there will be less hospital admissions and readmissions, and overall the cost of health care will come down pretty substantially. So as just an overview, telemedicine is really the large umbrella that oversees or overshadows both chronic care management and remote patient monitoring, those two pieces. You may or may not be familiar with chronic care management. I've talked to a lot of doctors who are, some who have implemented the program, and that has a number of requirements and hoops to jump through in order to monitor and to continue to be able to bill for that. Ultimately, total reimbursement on that is minimal. It's about $80 a month and requires, again, pretty heavy qualifications. The telemedicine as a whole enables you through video devices to meet with your patient either for wellness or regular medical office visits, and can be pretty profitable. But again, a wonderful tool to be able to bridge that gap between you and your patients. Remote patient monitoring is the tool that provides the specific diagnostic information that really empowers both telemedicine and chronic care management. Remote patient monitoring, and I guess let me get into details with it, through PMD works like this. You as a physician would contract with PMD for the fee of $45 a month. What they provide is a Samsung Galaxy Portal tablet that comes pre-connected with all of the diagnostic devices. So for the patient, they simply take it out of the box, plug it in, and begin using it. For that $45 a month, the patient is able to use the diagnostic devices which transmit their test results via Wi-Fi to the tablet, and then the tablet transmits that via cellular, again, which is all included in that price, via cellular to HIPAA-compliant web. And at that point, you or the patient can monitor those test results. The portal becomes a powerful tool of communication. So through that, you're able to do your telemedicine, you're able to enhance your chronic care management, and of course then receive data that's transmitted through it. Additionally, you're able to set goals and have more accountability with your patients, and also can use it as a marketing tool, an educational tool, and all of that contributes towards the qualifications of 20-minute a month interaction with that patient to receive the billing. The billing for chronic care or for remote patient monitoring actually can be as high as $165 a month. More typically, it's around $125 a month, and so the $45 fee for the communication tools is pretty minimal. The other piece of that is that the doctor is responsible for purchasing each of the devices, and they can really be customized to the patient need. The devices that we offer that are Wi-Fi connected are a blood pressure pulse, an SpO2 monitor, a weight scale, and a spirometer. Now, just as a brief aside, PMD is not new to this program. We've been actually here in Arizona working with Banner and Dignity Health for about the last 3 years on a pulmonary rehab program for patients that are discharged out of the hospitals. They send them home with these tools, and as a result of that, we've seen readmissions go down by about 67%. There are also, though we don't have them, you're able to input data from a temperature thermometer as well as glucose monitoring. So those are additional tools that we don't provide, but you are enabled to use those through this device for additional monitoring. As I said, all of that data goes to a HIPAA-compliant cloud, and that data is gathered. Now, one of the things that I like about this, that's probably one of the most powerful tools, is that every interaction that you or the patient have through this portal is documented by the second. So at the end of every month, whether it's been them watching an educational video, whether it's been you calling them or them calling you, any of those interactions cumulatively work towards that 20-minute requirement. And you can actually do 2 billings. That's the difference between the 125 and 165, is that you can do 2 monthly billings that qualify by the 20 minutes a month. It's a wonderful tool. At the end of every month, towards the end of every month, you can look up each patient and see how much you are missing that would qualify you for the first 20 minutes or even the second 20 minutes. Now, what's the value of the program? The value of the program is that you're able to give this to every Medicare patient, preferably those that are on Advantage programs, because there's no copay with that. But you're able to give this with every Medicare patient with no pre-qualifiers, ICD-10 codes. The only critical piece is that they need to commit to using the program. You're able, in many cases, to reactivate patients that perhaps you haven't seen in many years, and then more closely engage with those patients that you do see on a regular basis. You're able to set goals and monitor the progress of those goals. Again, preventative medicine. It minimizes overall the number of office visits, which patients like. They don't have to come in and of course now with the virus put themselves at risk. Again, you're able to do training, education, even marketing through this wonderful tool. Ultimately, what we see is that it'll be a profitable tool. It'll make your jobs easier. You won't simply be chasing CPT codes every month. It's a powerful tool for you to practice better medicine and better preventative medicine for your patients. So if you have further questions, I'm happy to respond to your phone calls, come out and meet with you, yes, even in the midst of the virus. So let myself or your distributors know. My phone number is 623-363-1775. Give me a call. I'd be happy to answer any of your questions. Thanks.